Exercises that we're going to show you for the low back. These are called back flexion exercises. The first one is a posterior pelvic tilt. What Gabby is lying down here, supine, with her knees bent to rotate her pelvis back. What she's going to do is she's going to go ahead and she's going to tilt her pelvis back, and then she's going to relax. So she's going to tilt her pelvis back and relax. Okay, she can do that 10 times. If they do well with that, they can progress to the next one, which is called a single knee to chest. She's going to go ahead and hold her pelvic tilt. She's going to bring one knee up towards the chest, both hands. She's going to release it and alternate with the other one. And back down again. If they do well, you can progress to both knees up towards the chest. The same thing, she's going to hold her pelvic tilt. You're going to bring one leg up at a time, one, and then the other, just for safety for the back. And then the same thing, release one at a time, coming down. And this is double knee to chest. If they do well, you can progress to what is known as bridging. She's going to lift her bottom up and back down again. Up and back down again. Okay? If they do well, then you can go ahead and start doing some abdominal work. The first one you can do is called abdominal isometrics. You're going to go ahead and you're going to bring one leg up. You see the hip flexed at 90, the knee at 90. She's going to place one hand here, okay? Imagine you have a wall here, and what Gabby is going to do, she's going to press in and press out, working on strengthening the lower abs. You can do that for 5 seconds, relax, and alternate it with the other one. If they do well, you can continue working on the abdominal muscles, doing a partial sit-up. You can remove the pillow. What Gabby is going to do, she's going to place her hands behind her head. Okay? She's going to go ahead and activate that posterior pelvic tilt to make a contraction to the abdomen. She's going to go ahead and lift her head and her shoulders up. Very nice. And back down again. And the same thing, make sure your patients do not hold their breath when they're coming up. If they do well, you can progress to strengthening the obliques muscles. What Gabby is going to do, she's going to bring the shoulder to the opposite knee, back down, and do the same thing with the other one. And these are called back flexion exercises.